Good afternoon, everyone, and thank you for joining us on the news briefing, the September 24th, 2025. The final decision has been made on vacation rental rules in our county coastal area, with the Board of Supervisors giving its final approval yesterday. We want to make sure those with rentals know about the new rules and what neighbors need to know about the new rules as well. We're very pleased to have Melanie and Beretti here with our Department of Housing and Community Development to talk about what these new rules are and when they take effect, and kind of give us a complete rundown. Hi, Melanie.
Hi, good morning or afternoon. It's afternoon, Maya, and everyone. Thanks for having me. Melanie Beretti, Chief of Planning with the County of Monterey. I'm going to to help orient, do just a couple of very brief slides for you all from yesterday's presentation at the board. Bear with me one moment. All right, hopefully you can see those.
Yes, I do.
Perfect. So yes, as of yesterday, the Board of Supervisors approved final adoption of the county's regulations for vacation rental operations in the coastal zone areas of Monterey County. Coastal zone on this map are the areas that are shaded in gray, outlined in blue. It includes the North County coastal planning area, as well as the Moss Landing Community Plan area. It includes the coastal areas of Del Monte Forest, the Carmel area planning, land use plan area, as well as the entirety of the Big Sur Coast planning area. So the approved regulations establish 3 types of vacation rentals that may be operated. One is a homestay, in which an owner occupies at least one bedroom within the rental while it's being rented, and it is the owner's primary residence. That's a ministerial or just a very simple over-the-counter checklist application. There are no caps. You can do a homestay anywhere in the unincorporated county. You are limited to 1 rental contract per week. Limited vacation rentals, so these are unhosted, where you can do a whole home rental for 1 to 3 times per 12-month period, but not more than 3 times. So for the limited vacation rental, similar to homestay, it's a ministerial or checklist over-the-counter application. There are no caps, so you can do a limited vacation rental also anywhere in the unincorporated areas of the county. You are limited to 1 rental contract per 7 days. The larger category are the commercial vacation rentals. Those are any unhosted rental in which you're renting greater than 3 times per month, or even if it was hosted, greater than 3 times per month, and with no contract limits, no limits on how many times you could rent. That is a discretionary approval process we will talk about. It requires a local hearing, and there are some location restrictions as well as caps on how many commercial vacation rentals we can have. So just a reminder, all vacation rentals of all categories are required to register and get a certificate for paying transient occupancy tax from the treasurer tax collectors. For all vacation rentals, you are also required to get a vacation rental operation license from the Housing and Community Development Department. If you're wishing to operate a commercial vacation rental, you also will process through a coastal development permit through Housing and Community Development. And then all operations are also required to then register for a business license from the treasurer tax collector. So a little bit more on the commercial vacation rentals. So they do require a coastal development permit with a hearing at our zoning administrator. Those permits are issued for 7-year terms, with each renewal having the possibility of up to a 7-year extension. And there is a 4% cap by planning area. So in any given planning area, we don't allow more than 4% of the existing single-family residential units to be receive a coastal development permit for commercial vacation rentals. There are a few areas where commercial vacation rentals are not allowed. The Big Sur Coast Land Use Plan does not allow commercial vacation rentals. The Carmel Area Land Use Plan, the low density residential portion, which is the Carmel Highlands, does not allow commercial vacation rental. And in the Moss Landing Community Plan area also, commercial rentals are not allowed in the low and medium density residentials. In all other zoning districts in these areas, however you would be allowed commercial vacation rentals with a permit. And again, in all areas in unincorporated Monterey County, a homestay or a limited vacation rental is allowed. So for next steps, what this means in the coastal zone areas is that the regulations that were adopted yesterday will become effective on October 24th, so 1 month from now. And there will be a 2 month time frame from October 24th for any operations that are operating currently without benefit of permits to come into compliance. So either come in to apply for a permit or cease operation by December 24th of this year. Staff does intend to return to the board with a report, just a general implementation status after the first of the year to provide an update for how everything's going. I also just wanted to share a couple of resources. There we go. So we do have our vacation rental webpage on the Community Housing Community Development. Under our Permit Center, you can go to Vacation Rentals. We will be updating this information to reflect the coastal zone approvals. It's not yet updated, but this is really the place where everyone should go as a landing spot to get your questions asked, answered, as well as to learn how to get started. So there is also on here a map app that you can link to, which allows you to see both a map of the operations as well as what's approved, what's pending, and what remains of that commercial vacation rental cap. So with that, I am very happy to answer any questions that anyone has. And thank you for your time.
And thank you so much for walking through this, because it is a complicated issue and it's been going on for a long time. So it's really great to give everyone a heads up about what's happening right now. There were several questions that came up at the board meeting yesterday about enforcement and maybe the complexities of the permit costs. I'm wondering if we could talk a little bit more about the permit costs and how are they affordable? Are you looking at changing them? How is that going to work?
Yeah, absolutely. So for the commercial vacation rentals, because those do require processing for a commercial vacation, coastal development permit, those currently cost approximately $10,000, which is the cost of a coastal development permit. So those can be costly. Again, those are issued for 7 years. In addition, you're required to get the vacation rental operator's license. So this is what all operations, homestay, limited, or commercial vacation rental operations need. The cost from Housing and Community Development for that license is $965. There are some other associated fees and costs that will bring your total costs up a little bit higher, depending on if you're on a septic system and you're required to get a formal septic system test and otherwise. The cost for renewals, so the vacation rental operator's license, which is the main license for homestay and limited vacation rentals, those are annual renewals. And the renewal costs are significantly lower. If there are no changes to how you're operating, that renewal cost is under $200. If you are making changes, but you've been in operation, then that renewal cost is a little bit more. It's right around $400 to process changes to your application. So there are some costs involved, and there is a process, a discretionary process through the approval of the coastal development permit for those commercial vacation rentals.
And thank you, because there was a lot of concern about the cost of some of these permits, but for people with a homestay versus a commercial operation, it's vastly different in terms of the cost of their permits and what they have to get.
Yes, it is very different and is much more affordable or intended to be much more affordable to get just the license and then the business license and TOC certificate. One thing also, staff, with a part of our keeping the board abreast on how implementation is going, we will also continue to review permit costs. We do cost recovery for the time required to process, but we are looking at putting efficiencies in our internal processes, especially for the coastal development permit or on the inland for the use permit, that might help us save some time and possibly be able to reevaluate those processing costs in the future. But at this time, they're the same standard cost for a coastal development permit.
And then one question that came in, is there room for growth in these areas that have caps? Are we, with what we have right now, are we at the cap limit in some areas or not at the cap limit for some areas? What's the growth potential here for people who want to do this?
Yeah, I think one thing that's important to know, there are some longer standing operations, and then there's also ebbs and flows in any given year in any given season. So we can't give precise numbers, but yes, based on information data that we have for how many verified unpermitted operations that we can see through our third party software, that can verify, there are certain community areas where should all of those operations come in to request permitting, we would reach the cap that was established by the board. But in most areas, based on the most recent data of how many operations, we do have some capacity. One of the things that staff is committed to the board as well is through our updates, if we start to approach one of those caps or limits in any of the planning areas, we would want to evaluate that. And, this is something that in the future, should the board desire, could consider if we actually see those permits that have been issued approaching those caps.
And another question that came at the board meeting yesterday was about enforcement. We now have these rules in place, but that doesn't mean enforcement is going to go away. And in fact, it might be more important now than ever before since the rules are clear. Could you just briefly recap what enforcement there is for these rules?
Yeah, so I think it's really important to note that last fall, when the board took its action to approve these regulations, which then went into effect in the inland area while we waited for coastal certification, at that time, there was a request to add some staffing to Housing and Community Development Department to be able to support code compliance with these new regulations. So, with that, we were able to increase our staffing levels by 2 code compliance officers. Recently, we've been able to have both of those positions now filled, and they work during hours and are available to do investigations when on the times when vacation rentals are operating. So, we do have those 2 code compliance positions that are working on code compliance. We also have some additional resources that were added to help the Housing and Community Development Department process permits, which goes a long way as well to help bring people into compliance as quickly as possible. And so we do have those positions. One is filled and one is hopefully imminently being filled. So we also are moving through those permit applications as quickly as possible.
And I know there's a phone number that people can call if they're a neighbor and they think that there's something happening at a home that is unpermitted, that there is a rental. And I will definitely share out that number. And I know that there's designs in place to do some publicity also about that number so that people know where to call if they have a concern about a possible illegal rental.
Absolutely. And again, a good place to start if you're curious who's permitted to operate, and if you want to get information on when and how to file a complaint, the Permit Center Vacation Rental page has it. Also, the number you can call is our code compliance 831-796-3674, or you can file an online complaint as well that will be looked into. And I really encourage folks to, I know we've been waiting a long time for these regulations to come into place. It will be a process, it will be a transition while operators come in to make their applications, while our code compliance works with those individuals who may not be making efforts or able to come into compliance to get those unpermitted operations to shut down. So we welcome you to reach out to our team should you have concerns and issues, and also really invite everyone to know that this will be a bit of a transition over the next number of months as these regulations roll out in the coastal zone, in addition to continuing to roll out in the inland areas.
Melanie, thank you so much for coming, doing this all over again. I know you spent a lot of time doing it yesterday, but I'm really appreciative of you walking us through some of the key parts of this really big decision.
Thank you, Maya. And we'll let everyone know that the Housing and Community Development, we will be offering a webinar. We don't yet have the time and date scheduled, but we will be offering a webinar for any individuals who are looking to really understand, how do I come in and fit into these regulations and come in and apply. We will be offering that webinar, and we will work with your office to really distribute that time and availability for individuals.
Great idea. Thank you so much, Melanie.
Thank you. Have a wonderful day.
Well, this year marks the 50th anniversary of the Natividad Family Medicine Residency Program. It really is hard to imagine what healthcare in our community would be like without this program, which has graduated hundreds of doctors and still continues to train the next generation. We're very pleased to have Dr. Melissa Nothnagle. She is the Natividad Family Medicine Residency Director and Chief of Service, and she's going to tell us a little bit about the program. Hi, Dr. Nothnagle. Thanks so much for being here, and it's a great thing to celebrate.
Yeah, thanks so much for inviting me. We had a really wonderful celebration this weekend, marking that 50 years of training physicians in family medicine at Natividad. And the residency opened in 1975, and we've now graduated 358 family physicians. And we had hundreds of them come back to Natividad for the reunion this weekend, along with lots of current and former teachers, faculty members. And we included a great faculty lecture series with outstanding presentations on issues like health equity and addiction medicine, reproductive health, cardiology. Dr. Alan Radner from SVH gave a fantastic talk about vaccines and the current political environment. And then we had hosted great social gatherings for people to reconnect, and a formal dinner on Saturday night. And I was just really moved by the ceremony, hearing stories going back through the 50 years. We had several members of the first class who started in 1975, including Dr. Bruce Greenberg, who is still practicing in King City. And the common thread from those stories was really the focus on helping address the needs of our communities, and some of the really exciting advocacy work that's been done over the years to improve the health of our farm workers in particular. The mission of the residency is to train physicians in the full scope of family medicine, which for us means care of children, care of older adults, pregnancy care and delivery, taking care of patients in the hospital and in the clinic, so that they are ready to go out and meet the needs of whatever community they land in, particularly the more underserved communities where there's limited access to care. And each year we bring in 10 new medical school grads to do their specialty training in family medicine at Natividad. And actually today was the day our applications opened for this recruiting season, and we already have close to 600 applications for our 10 positions. I have a lot of work to do to sort through those and pick who we're going to interview. But we really do our best to recruit young doctors from the Central Coast and California. We have some great candidates from the area this year. And we always get a few from outside of California and around the world too. So it's a really diverse group of folks that we have training with us here. And they're with us at Natividad and also at the Monterey County Health Department clinics for a very rigorous 3-year training. You've heard about residents working long hours. They sometimes are working up to 70 or 80 hours per week, which gives them a chance to take care of thousands of patients to get the experience that they need to be ready for independent practice after the 3 years. And we also try to keep our residents local. We've had, in the past 5 years, over half our residents have stayed in the Central Coast, either practicing in Monterey County, Santa Cruz County, or San Benito County. And again, we attract folks who want to work in communities of need. So about half of our grads end up working in safety net healthcare settings. The other thing we do to reinforce that during the residency training is to have them all participating in lots of community activities. We have a community medicine project that each of them is required to do, focused on how do we improve the health of particularly marginalized communities. So they're involved with things like setting up an addiction medicine care team in the hospital, going out and training our promotoras or our community health workers that go and provide community education. They go and do direct community education through, there's a Cosechando Salud lecture series that they do out at our community centers around the county. And lots of other great examples of engaging with different nonprofit organizations in the community to support the work that they're doing to meet our community needs. So yeah, any questions that I can take about?
Thank you for kind of, wow, you do have a lot of work ahead of you. With 600 applicants, I was kind of blown away by that. But one thing I mentioned before, and I want to ask you again, it's really hard to imagine what medical care might be like in our area without this residency program. It's been here for 50 years. You get these 10 people coming in, they have this rigorous program, and then most of them don't leave. It's just hard to imagine where we'd be without, we now have this really robust resource of doctors that have, come right from Natividad and into the community. Why isn't every hospital doing this?
Well, most hospitals want to. It's expensive, though. It's an investment in the community. So I think that's the real important message is, we have to pay doctors to supervise these residents. In the olden days, that was the other thing interesting to hear, was talking to the folks who were working in the 70s and 80s. They didn't have a lot of supervision. They were kind of winging it a lot of the time. And modern medical training does not allow that. We are responsible for the care that our residents and students give, and we're overseeing it very closely and making sure that they're getting great teaching and feedback on everything they're doing. But that means an investment in faculty time, which means we're not out, cranking through patients and generating lots of revenues. So I think understanding the huge payoff over time when you make that investment and train fantastic doctors who are going to stay in your community and meet the needs locally, that all hospitals are trying to open more. So you'll hear about lots of new residencies have opened in California in the past 10 years. But those who were around originally, like ours, are all celebrating about 50 years and have had a huge impact on their community over that time.
So of your 600 applicants, as you go through that pile of resumes, what are you looking for the program?
We're really looking for folks that are aligned with our mission, right? So folks who want to be able to take advantage of the training we offer here. Some residencies aren't going to prepare doctors as well to do that full spectrum of care. They might focus more on outpatient care, for example, or not have as much pediatrics or OB or geriatrics. We're really doing it all. A well-established program like this has had a long time to get it right. So our graduates are really well prepared to work in any setting. And I was really blown away by them when I started working here 8 years ago, at how talented the faculty and the graduating residents were. So we want people who are excited about that, to have that high quality training, and folks who are really committed to working for marginalized patient communities here. So they're mainly working in Natividad and the Laurel Family Practice Clinic, which is a safety net clinic that takes care of Medicaid and uninsured and Medicare patients. So really folks who are interested in understanding our farm workers experience, or who actually understand it because their parents were farm workers. We have a whole bunch of residents who are coming from immigrant families, many of whom came here to work in the fields and now have gotten their children a great education, and they have the chance to come back and train here and serve their communities, which is just, I'm living the dream when that happens. It's really fantastic.
That's a feel-good story just on its own. But the other thing, and there was a question about this residency, it's really for family practice. You hear a lot about specialty and people who want to go into orthopedics or other aspects. This is really geared towards kind of the whole person, the whole family, which some people say there just aren't enough of right now.
There are absolutely not enough of. We have a huge shortage of primary care physicians, and Family medicine trained folks are really the best equipped, particularly to meet the needs of communities that might be farther from big academic health centers. Because if with one family doctor, you can take care of children and pregnant people and older adults. You don't need a pediatrician, an OBGYN, and an internist to do that same care. So it's a little bit more cost effective as you're putting together a healthcare system to have more generalist, we call it sort of kind of generalist specialists, right? We're specialty trained for 3 years in being able to take care of most of the needs of most people, and really focusing on what's going on in the community where we are.
Dr. Nothnagle, thank you so much for being here, and congratulations on this anniversary, and congratulations on bringing everybody back for a fantastic reunion. And we look forward to your next group
Great. Thank
of
you.
folks, and we welcome them with open arms.
Thank you so much.
Our next topic, issues like homelessness are complicated, and we all need to get together and talk more about it. A documentary screening event next week does just that. It gives us all a chance to watch the film and ask questions of experts. We're very pleased to have Jill Allen with us. She's with Dorothy's Place, and she's going to talk about this film event experience and what we can expect. Hi, Jill. Thanks for being here.
Thanks for inviting me. I really appreciate the opportunity to be able to present in this forum. It's a very well-respected forum.
So tell us more about the documentary event.
This impact screening is a documentary film, but it is different than other films that you may have seen or your neighbors may have seen about unsheltered homelessness. It does sort of give you a personal introduction into the lives of a couple of people that are experiencing or had experienced unsheltered homelessness. However, the film spends most of its time talking about solutions, and it is filmed by a couple of producers, each with their own expertise, literally driving thousands and thousands and thousands of miles, crisscrossing the country, going to urban locations that have dramatically reduced unsheltered homelessness, and trying to figure out how they did it. And they've captured this on film. The film is not only informative, it's entertaining in a certain aspect, it's positive and hopeful because these communities are showcased, and many of the community decision makers are there being interviewed on film about how they did it. There is one common thread with all of those locations and all of that testimony, and that is that for each location, the solution, in fact, is unique. It is suited to their location, their challenges, their struggles, their opportunities. The common thread, however, is that for each location, it was a community lift, an entire community lift from every segment of the community, faith communities, business, government, social service providers, philanthropy. Everybody got together in their community and started with a very difficult discussion. And then as they persisted and things sort of settled out, they found that everybody, whether they came from the camp of, we believe that homelessness will always be with us and we will never solve it, to the camp of, yes, there are ready solutions. We think we should put everybody into a subsidized apartment and then we're going to solve it. Those two different ends of the spectrum came together in a middle space to actually take action, and it worked. So I would very much encourage, as you can tell by my screensaver here, I am actively promoting this event. It is next Tuesday evening at Sherwood Hall. The doors are open at 5. The program begins at 6 with some, brief introductions, but then the impact screening. The producers will be there present for the hour before the program starts for those people that want to get there a little bit early, We've got some small bites out for people because we realize that we're actually doing this during a dinner hour. So you will be able to grab a sandwich and a salad and a drink and take it into the auditorium with you. But we're hoping to have what looks like could turn out to be a 500-person attendance at Sherwood Hall next Tuesday night. Starting at 5:30, we want people in their seats by 6 so that we can start promptly. And then the film is followed immediately with a 45-minute discussion panel. And we're still lining up the discussion panel, but right now we've got 4 confirmations, one from state government, one from, well, it's Cal ICH, 2 from state government, 1 from local government, 1 from the business sector, possibly 2 from the business sector, 1 from health. And we're hoping to give the discussion panel a nice balance so that everybody in the audience learns from this. And then hopefully follow that up with deeper discussions later.
Jill, you're bringing a lot of people together, and you talked about camps over on one side, camps over on the other. There are a lot of different camps, and a lot of people will come with their own ideas about what they think homelessness is, what the problem is, what the solution is. This is a big ask for people to come with their preconceived ideas and listen to you. How are you surmounting
well,
that?
they won't be listening to me. They'll be listening to a lot of experts, but we want all of those diverse opinions to be there. We want the people that say, this is never going to work. We want them to be there. We want the people that say, oh, we could have made this work 10 or 15 or 20 years ago. All of that needs to be present because it's going to take the entire community to make this work in the long run. Now, I think everybody here and probably anybody listening realizes that 50% of Monterey County's homeless population is in the city of Salinas. And you know, we're placing this in the city of Salinas because that, but we're encouraging people from all over the county to be there because my fondest wish, my greatest hope is that this turns out to be not just a Salinas solution, but a Monterey County solution that will turn into a regional solution. We see so many people in unsheltered homelessness go from Santa Cruz County to Santa Clara County to Monterey County to San Benito County and back again because there's yet no solution.
And you talked about one of the unique aspects of this impact, the documentary, is that the common thread was every solution was different. And is this the goal of hearing from everybody? Because there was no one-size-fits-all solution across the United States that worked. Every community had to figure out what worked for them.
Exactly. They have to figure out what worked for them. But the one common thread, as I said, was for each community that made it work, they gathered everybody together and had every sector at the table discussing and coming to common sense solutions that were going to work in their community. For example, I believe Houston decreased their unsheltered population from somewhere around, I want to say 40,000 to 8,000 within a year. Like, wow, mind-boggling. But Houston's probably got a lot more real estate and a lot more low-income housing than Monterey County has, or any of the coastal communities here. So what happens here is going to have to fit us. And it's going to mean out-of-the-box solutions. It's probably going to mean transitional solutions. But what you'll learn, what anybody will learn coming to this is that, you know, right now we're way too dependent on government. We're way too dependent on tax dollars, which will never be enough. And that they'll learn that it is actually less expensive to maintain an individual that cannot support themselves, that is permanently disabled, to maintain them in their own housing than it is to maintain them unsheltered, because everybody in unsheltered housing, pretty much across the board, uses the emergency department at Memorial, Natividad, or CHOMP for their medicine. Emergency medicine is the costliest medicine on the face of the planet. They are also, they have multiple misdemeanors racked up against them for violations. Many of them have felony violations that send them to jail or to prison. All of that care costs a lot of money. We need to take a full community to look at this and see what resources we can divert or capture to make a common sense solution for Monterey County.
Well, Jill, I really appreciate you starting this conversation and making the move to bring everyone together. And we're really looking forward to the event next Tuesday.
Thank you so much, Maya.
Thanks for being here. And thanks everyone for joining us on the news briefing this week. Our next briefing is next week, and we'll see you then.